Hey, Facebook. How's it going? This is Yvette McQueen, MD. It's 3 o'clock p.m. Monday, August 14th. So I'm here for my Monday session, Facebook Live of Thoughts from Emergency Doc. So I'm Yvette McQueen, MD, emergency physician and travel doc, a global physician on a mission to educate about health, travel wellness, and disease prevention. I help busy and not stressed out, just busy professionals with their travel needs, travel consultations, and then traveling well, keeping them healthy while they're on their journeys. So Monday afternoon, Facebook Live sessions, Thoughts from Emergency Physician. And I'm here at the airport. I was going to say I'm a travel doc. I travel around doing different assignments. So it's Monday afternoon, about to head out and work Tuesday through Friday and come home during the weekend. So I was actually in the lounge and it was a little bit crowded and a little busy, so I thought I would come out here to the lobby and do my Facebook Live. So here we go. I'm sitting here, so I'm not set up. I was rushing. Whew, sometimes you rush. It's like I got 2 minutes to get it together. Anyway, so today's topic about medications, prescriptions, and the opioid epidemic. I know everybody wants to talk about that first, but we'll leave that to last. So if you're out there, Facebook, you want to hear it, come on in, say, hey, I'm here. Let me know if anybody's listening. Medications. So one thing we, as an emergency physician, when you come in the emergency room and the nurse puts your information in the computer, your past medical history, they want to know your medications. And it's a good thing to know the dosage of medications. So a lot of people don't know why they're on certain medicines. Remember last week I told you about on your smartphone you can input your health information in case you come to the emergency room unconscious. Well, one of the things you can also put on there is your medications and actually dosage. So say you take Norvasc or amlodipine. That's a high blood pressure medicine. We want to know what dosage. Is it 5 milligrams? Is it 10 milligrams? Is it once a day? Is it twice a day? Those are the things we like to know. And you should know that you've taken it for hypertension. So when a doctor gives you medicine, even your primary care doctor, so they say, well, you have bronchitis, so I'm going to put you on prednisone. And so you need to say, doctor, what type of medicine is that and why are you putting me on that? So prednisone is a steroid, so you should know you're on a steroid, and you're putting it on there for the inflammation in your lungs. Or if they say, you know what, you have been having problems with your arthritis, so I'm going to put you on blah, 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 blah. So you should know you're on that for your arthritis. So when you come to emergency rooms, you can say, yes, I'm on high blood pressure medicine, or on diabetes medicine, or on heart medicine, and this medicine I take for my arrhythmia or my AFib. And instead of saying, well, doc, I take that little white pill. You know how many pills are white? Yeah. Or the orange oval pill. It doesn't help us. Now, there's occasionally when we get, of course, some unconscious overdose people, and if they have pills in their pocket, there is a pill identifier, but we don't do that on a general basis. We want to know your medication and your dosage. So that's always helpful for your doctor. Plus, if you're here in the emergency room and you're here for something, and say you're here for arrhythmias, so if I already know you are on Sodalaw for your heart arrhythmias, then I can either increase your dose or change your dose or just put you on a totally different medicine. So I don't want to put you on something else that's going to contraindicate or go against or cause more harm, because that's our first physician, do no harm. That's an oath. So we need to know what your condition is, what you're taking, so I don't hurt you anymore. So let us know what medications you're on, what dosage you're on, and how you take the medication. So this is going back to how you take medication. Some people will say, I want you to take this medicine twice a day. Does that mean you take, well, I got up at 10 and I took it, and then I remembered to take it again at 2 o'clock in the afternoon, and I'm done? That's not how medication works. Medication actually sits in your system for what we say a lifetime. So we want to know how effective is that medicine halfway through. So if you're taking medicine, back to hypertension. So if you're taking a medication, one that we give is called metoprolol. It's a beta blocker. So if that medication, you take it twice a day. They tell you need to take this medicine twice a day. Most of the time we want you to take it while you're awake. Don't wake up taking the medicine, have some antibiotics, you should need to set a timer. But so if you take metoprolol, the half-life of that medicine is considered 12 hours. So at another 12 hours, or the lifetime of that medicine is 12 hours, put it right. So you need to take it again at another 12 hours. So if you take it at 8 o'clock in the morning, you should take it near and around 8 o'clock in the afternoon. If you don't get up till later and say, I'm gonna take my medicine at noon, well, hopefully you're not up at midnight, but you might be. But try to space out your medicine. So, antibiotic. So we're treating you for bronchitis, and we tell you to take Bactrim twice a day. Don't take it and say, oh, I got up in the sick at 7, and then I took it again at 2 o'clock in the afternoon. That's not a 12-hour period. So then between 2 o'clock in the afternoon and the next morning at 7 is more than 12 hours. So it's really filtered out of your system. So your system is starting all over again. And that's that small window that bacteria can actually get used to that medication or overgrow. So particularly antibiotics. If we tell you, and I tried nowadays, I've learned that people take the word 3 times a day literally and takes it 3 times a day randomly. I try to tell people every 8 hours, or I put that on my prescription now, every 8 hours. So some of you physicians out there, if you listen to me, I've noticed that with people, and they say, oh, I take it 3 times a day, 10, 2, and 5. Well, that was not helpful because the antibiotics stacked up on each other. So I will say, if I want you to take it twice a day, you take it every 12 hours. If it's 3 times a day, every 8 hours. If it's 4 times a day, it's every 6 hours. And how do we figure out those times? Once again, it's been studied to show actually what is the life of a medicine in your body, how your body metabolizes or break down that medicine and use it appropriately. So if a doctor comes and put on your prescription, take this medicine 3 times a day, and you saying, wait a minute, Dr. McQueen said I need it in hours. 24 hours divided by 3 is every 8 hours. So if you see in medicine, see it 3 times a day, then make sure you take it every 8 hours. So that makes a difference in how you take your prescriptions. If we're in an emergency room and you come to us and we give you a prescription, please, my biggest suggestion is get that prescription filled. Because we gave it to you for a reason. And you actually, you came here for an ear infection. And you decide to get that medication filled a week from now. Well, one, either the infection is already gone, because basically you can't cure yourself. Whoever's out there, hi, I can't see who's on, unfortunately, so just say hi, whoever you are. Thank you for watching. I'm talking about medications and prescriptions. Oh, hey, Lauren, that's my college friend. How you doing? So I've been talking about medications, about how you need to write down your medications, and your dosage. So you need to know what medication you're on, the dosage you're on, and actually you can put it in your smartphone. I talked about how your health can be placed in your smartphone in case we need, if you're unconscious, and we can actually access it in an emergency. And you need to know what medication, why you're on a medication, not just the white pill for this. So, and now I'm talking about medication and why you need to space it out. So if we give you a prescription and it's every 8 hours, then you're taking that medication every 3 times a day is every 8 hours. Twice a day is every 12 hours, because that makes the medicine more effective in your body. Yes, my friend from college. So, and then your prescriptions, if we give you a prescription out of the ER, get it filled, please, because we evidently was having it filled for a reason. We wrote the prescription for a reason. So don't wait a month or 2 months later. Actually, I've had people call back to the ER and said, oh, well, you know, I got a prescription a month ago and now I can't get it filled. Well, the condition is gone, it's gotten worse, you don't need it anymore. Get your prescription filled. That's very helpful. And now I'm going to talk about the epidemic that they said they labeled a national emergency. Now, I understand they labeled a national emergency because they want people to be aware, but I'm just going to go out and say it. You know, 20 years ago when there was a crack problem, did they label a national emergency? Yeah. So this is with the opioid epidemic. Has opioids been Narcan, Norco, Vicodin, Percocet, all those, Oxycodone, Oxycontin, have they been prescribed too much? Yes. Actually, we're the leading country in the world for prescribing those medications. And I'm going to take it back a few years ago when, 15 years ago, when they came out and said pain is the 5th vital sign. Pain is not a vital sign. Pain is subjective. It's not objective. Vital signs are your blood pressure, your heart rate, things we can measure. Pain is subjective, which means you decide what your pain is. It's not something we can actually measure. Even though they give you those nice little faces and they say label it 1 to 10, that's great, because my 10 is not your 10. So we all do know that. So the opioids, so there's like, oh, pain is the 5th vital sign. Okay, and you got to treat people's pain. And then right behind that, they came out and started talking about patient satisfaction, and patients need to be satisfied. Yeah, I do believe patients should be part of the healthcare system, and I think they should be decision makers. But they came to a point where now they kind of force physicians to make patients happy, and that's how some of the antibiotic excess use of antibiotics got out of hand. Oh, if a patient walks in and he wants an antibiotic, give it to him. No, I don't, because then viruses are not cured by antibiotic. Everything is not treated by antibiotic, and now bacteria has become sensitive to antibiotic. We've gotten superbugs. Same thing with pain medication and opioids. You know, if they come in and relieve their pain, okay, you can reduce pain, and there's reasons to reduce pain. And actually, according to pain, you're only supposed to read 2 points. So if you come in as an 8, I'm going to reduce it to a 6. We try to reduce it under 5, but I'm telling you, you may not have 0, and that's okay, because that's the body's way of telling you something's wrong. And we just unfortunately live in a society where people think we should be pain-free, and that's just not real life. I mean, if you hurt something, you broke a bone, it's gonna hurt. It's gonna hurt until it starts to heal itself. So I can reduce the pain and make it a little bit more comfortable, but I'm not gonna take away your pain. And that's what people try to do, take away the pain too much. And give the patient a pain, they're satisfied, they'll give us great satisfaction scores. And then they start tying in insurance reimbursement to satisfaction scores. So hospitals was pressuring their doctors, give people what they want so that we can actually get paid. So if people get low satisfaction scores, insurance say, well, you're not doing adequate care, even though they gave medical care and quality medical care, the patient wasn't satisfied, so we're not going to pay your bill. So then the administration comes back to the doctor and say, well, you need to get a patient what they want so they can be happy and satisfied. But that's not good medical care. Not good medical care. So people was pushing out pain pills, and then someone non-medical, I will say, found out, oh, well, we could have people come in and figure out if they complain about this or give us a pain scale, the doctors will write a prescription, and they became pill mills, especially Florida. Florida was good for it up and down 95, what we call the pill mills. They started to crack down in the last 2 years, but at that time, it's already gone. There are people addicted to opioids. So there's a major addiction, and the major addiction has infiltrated into major society, and that's why it's drawn the attention now of everyone, because before, oh, crack, oh, okay, that's inner city, and that's poverty, and blah, blah, blah. But now opioids are hitting the teenagers. They go in their grandparents, so opioids was given for arthritis and other things, and they're going in their grandparents' medicine cabinets and taking it. It's becoming, suburban housewives. You hear about a mayor's son, or you hear about, the teacher, or you hear, right. It's major society, and people are hooked on opioids now. And now that's why it's drawn the attention of the population and become a national emergency. So opioid overdose. So that's why. And then now that people can't get it through their pill mills, or they've taped down the medicine they've given, then unfortunately, the next thing that will actually help it is heroin. So, in your liver, you take the Norco, the Vicodin, and it breaks down. It's part of one of the morphine type medicines, but heroin would give the same high as, say, Norco. So if someone can't score Norco or Vicodin or Percocet or Oxycontin, Codone, whatever, the different names, you can't score down the street, the next thing is that. And that's how it's become an epidemic. And now, so reversal drug is Narcan, or naloxone, Narcan. It always was carried by EMS. So if someone was overdosed and they thought it was a drug overdose, they would give that to try to wake them up, because what opioids do is suppress your breathing. So you'll actually stop breathing. You take too much, you'll stop breathing, and then you die. They have always taken Narcan and they overdose, or we get them in the emergency room. We give them Narcan, yeah. We give them Narcan and like, hey, where am I at? Where am I at? And now they want to sell that over the counter. They want to sell that in Walgreens and CVS, because it's become such a problem that it's like, well, I have friends that are drug users, so I'm gonna have Narcan available in case I see them and they're overdosed. The problem, good idea, good thought process. The problem is that sometimes some of the medication and the different forms that come can be so powerful that, yes, you can wake someone up, start breathing again, but then they stop breathing eventually. They'll stay awake for maybe 20 minutes and then they stop breathing again. And that's a big problem. So that's the biggest problem with not understanding Narcan and how it arouses people. And we're worried about it can only be a temporary measure, that they're like, oh, they're awake, we don't need to call EMS anymore. Yes, if someone has an overdose and you respond them, please call EMS, because they still need to be taken to the hospital. And it has some physicians just overuse their power. Yes, I agree with that. Because they'll get patients in and they'll bring their bottle in and they'll have 120 pills. Who writes for that? So those type of people need to be in a pain management environment. In a pain management clinic, you make a contract with your doctor. You're only using so much because pain should be controlled, and people do have chronic pain that needs to be controlled. So that's why we try to send people to pain management, where there's a contract and there's an environment, a helping environment for their pain, and there's alternative ways for pain control. So that's what emergency physician is thinking about the opioid epidemic. But we see it, I've been seeing it for years. Been emergency physician for 17 years. 17 years, wow. And I've seen it. And it's just hitting a different population. So I can't say it's more of an epidemic before, because people have been overdosing on medications and more, but it's just hitting a different population. And also today, there is not just straight like opioids with say Percocet. They're taking those pills and mixing them with fentanyl. So if you think about, there's the different levels of pain medicine. So there's morphine. That's a natural one that we know, and those hit certain receptors in your brain. We call those the mu receptors. Morphine. So we base everything off of that morphine level. So some people like hydromorphone or Dilaudid, the D word, and that's like 2 times more potent, or 2 times more stronger than morphine. Fentanyl. The fentanyl is usually given like if someone's having a procedure or surgery or something like that. Fentanyl is 10 times more stronger than morphine. That's out there now in the streets. That's what people are overdosing, because they don't realize how potent. So they're gonna take a little Percocet and add a little fentanyl to it, thinking, oh, this is just gonna be a little bit more higher, where it's a lot more higher. And that's why people are overdosing. So there's a different population it's hitting. It is a little bit more stronger. People need to be aware what's going on. Signs and symptoms of someone's not breathing, you need to call 911. And even if you arouse them, call 911. You use Narcan, you still need to call 911 and get that person help. So these are thoughts from an emergency physician. Thoughts from emergency doc. You know, your medications, know your medications, why you're taking it, what dosage. Put it in your smartphone. Make sure you bring it. Make sure you know why you're taking it, for what condition, how to take the medication appropriately. Get your prescriptions filled when we write prescription for the emergency room. And yeah, opioids. So this is Yvette McQueen, MD, a global physician on a mission to educate about health, travel, wellness, and disease prevention. You can follow me here at Yvette McQueen, MD, Facebook, and all other social medias. So travel well. Ciao.